WAJR's Ask the Experts continues. I'm Tony Caridi, along with the folks representing HealthWorks Rehab and Fitness, Trevor Jones, physical therapist, Dr. BJ Balsick, WVU Medicine, and the team physician for the Mountaineers. So, heck, he's got nothing going on this summer. I mean, nothing at all. He's been very, very boring summer as the one of the team physicians for the Mountaineers. Not much going on over there, huh, BJ?
No, it's been pretty slow, actually.
Catching up on paperwork.
Yeah, pretty much.
Our topic here is concussion and how to identify number one and then how to deal with number two. So let's get to that point. When someone has been diagnosed with a concussion, I'll give this one to you here to start things off with, Trevor. What then happens?
So one of the first things we do, especially at the high school level, is we get a referral for a physician. So whether that's primary care physician, pediatrician, or sports medicine physician like Dr. Balsick, we want to have established that point of care. So if things don't go the way we anticipate, the physician's already familiar with the injury. So that's number one. Number two, we have that baseline set of symptoms, whether it's at our high schools, we use the impact tests, or with our collegiate athletes, they have the C3 test that they can go back to. So we've established where we are with the baseline. We do our follow-up testing to see if there's any specific neurological deficits. And then we're just monitoring. So initially, especially like you said, 15, 20 years ago, we managed things way differently. And, even 5, 10 years ago, it was rest, rest, rest. Well, now we're moving to a little bit more of an active approach. So, initial rest for the first day or two is fine, but then you're wanting to start some physical activity pretty much right thereafter. So, you were working at a sub-symptom threshold management of exercise. So maybe walking or a stationary bike, 15, 20 minutes at a time. And as long as their symptoms aren't exacerbated, that's fine. So we're not getting into a deconditioning phase. We're not getting into phases where people aren't exercising for weeks at a time. So, that kind of thing can lead to depression and anxiety, especially in folks that are already prone to or have that to begin with at baseline. So we've really moved to more of an active early approach. But they're obviously not returning to sport until they're asymptomatic.
That's really interesting. Was not aware that you guys, instead of pulling back, now you're starting to get them right up and moving around to a degree, huh? BJ, when you're in the emergency room, you see all forms of concussion. You see sport concussion and you see trauma concussion as well. If you would kind of give me your thought and what are the walking papers you give your folks as they deal with it?
Initially, it's kind of like what Trevor said, is the first couple of days you want to rest. If they're in a high demand job, specifically around here, coal miners specifically, we see a lot of them. They may need a few days off of work. But then we tell them, you can do, light physical activity after a few days, but if it's anything that's causing your symptoms to get worse, headache, dizziness, nausea, then they're probably not ready to get to that point yet. So initially it's just rest. And then the big thing for us is making sure they get in to see somebody here at the concussion clinic or their physician to help manage that.
You mentioned the concussion clinic. What goes on there?
It's a group of primary care sports medicine physicians, myself and a few others, where we do an initial evaluation, and depending on where they are, how many days out they are from their injury, we may set them up to see a physical therapist or vestibular therapist like Trevor, or we may just recommend continued rest. There's some other things we can do, but that initial visit is an evaluation, and then kind of the rest versus slowly getting you back as the first steps.
Here's a question that doesn't have an answer. It's kind of like going into a car dealer and say, how much does a car cost? Well, it could cost anything. So here's my question. How long does it normally take to come back? And I know everyone is different, but what would be the range if someone suffers and I don't know if you qualify as moderate or severe concussion, what's the range before you guys normally feel comfortable for someone to go back out?
So, and kind of touching on what you just said as well, we've come a long ways, and we don't even term mild or severe concussion anymore, which is, they used to have grades 1 through 3, and now it's concussion. Mm-hmm. But for adults over the age of 18, we anticipate that people will be back, quote unquote, back to normal within 1 to 2 weeks. And then the normal for pediatrics, anything less than 18, anybody less than 18 is 3 to 4 weeks. So up to a month is still considered normal in the high school population.
When you have one, does it make number two happen easier?
That's an excellent question. The data would say that you are more prone to concussion with each successive concussion. And by that I mean you may have a mechanism which may not be that high energy, but could give you that second concussion where you may not have had one the first time, even to the point where just a whiplash type injury could give you a concussion.
Sure. Before you guys probably were around, Nick Patella was a standout player at Elkins High School, then came to WVU as a walk-on. He's now the head coach of West Virginia Wesleyan. Ultimately, that ended his career. Just multiple concussions. It was just a style of play. He was always after it and just repeatedly had them. And finally, you get to a point where it just gets too dangerous.
Mm-hmm.
This is one of those deals where oftentimes when you guys come on here, we can talk about preventative things that you can do to stay away. I would imagine the only thing that you can do as far as preventing a concussion would be if it's bicycling or if it's in the workplace, you have to have another shell on top, right?
Yep, that's correct. I mean, helmets, protection, those are the big things, especially you mentioned cycling. I can't remember the last time I was ever on a road bike without a helmet on. So that's the first step. Unfortunately, there's no 100% guarantee in athletics.
Yeah. You have an interesting profession because you're WVU team physician, you, AJ Monceau, among others. And at the same time, your regular gig, your day-to-day, is you're in the emergency room at WVU Medicine. When people present with concussion, if you were to say, what's the most likely reason why they come in, what is it? Is there a certain thing that happens? Is it in the mines? Is it athletics? Is it bicycles? What's the commonality of the concussions that you see?
I'd say from the emergency department standpoint, it's car accidents.
Yeah.
That seems probably off the top of my head. I'd say that's the most common.
Yeah. And even though people are wearing seatbelts, it still is going to happen, probably the whiplash effect.
Exactly. Seatbelts, even though they protect your chest and your torso, you still have that whiplash injury. And oftentimes people will say they didn't hit their head on anything, but still have concussion symptoms.
Our guests are Trevor Jones and Dr. BJ Balsick, and we are talking about concussions. We'll be back with more, and this program is being brought to us by HealthWorks, Rehab and Fitness, locations throughout North Central West Virginia. If you've got a question that you'd like answered, more detail of something that you've heard, 599-2515, 599-2515, and for no charge at all, throw in the area code 304-599-2515. Stay with us, more coming up. WAJR's Ask the Experts.